Question 1. Radiation protection and safety. A medical radiation technologist is performing a fluoroscopic examination on a pediatric patient. The procedure requires multiple exposures over an extended period to minimize radiation exposure while maintaining image quality. Which of the following strategies should be implemented? A. Utilize the highest dose settings to reduce motion artifacts and repeat exposures. B. Minimize the use of collimation to ensure the entire area of interest is visible. C. Increase the distance between the X-ray source and the patient while using appropriate shielding. D. Keep the fluoroscopy beam continuously activated to avoid repeated exposures. Answer. C. Increase the distance between the X-ray source and the patient while using appropriate shielding. Explanation. YALARA, as low as reasonably achievable, principle dictates that radiation exposure should be minimized using time, distance, and shielding. Increasing the distance between the radiation source and the patient reduces exposure due to the inverse square law. Proper collimation narrowing the X-ray beam reduces unnecessary exposure by limiting the irradiated area. Option B is incorrect because minimizing collimation increases exposure. Using the highest dose settings, option A increases radiation exposure without necessarily improving image quality significantly. Motion artifacts can be minimized using shorter exposure times and immobilization techniques. Keeping the fluoroscopy beam continuously activated, option D, significantly increases the radiation dose. Instead, intermittent fluoroscopy be used to reduce exposure. According to Health Canada and the CAMET guidelines, pediatric patients are more radiosensitive, requiring additional precautions in dose reduction. Question 2. Scenario-based question. Patient care management. Mr. Dawson, 63-year-old patient with history of chronic kidney disease (CKD), arrives for contrast-enhanced CT scan. The referring physician has ordered an intravenous iodinated contrast agent for improved visualization. However, the patient expresses concern about potential complications related to his kidney condition. What is the most appropriate action for medical radiation technologist to take? A. Proceed with the contrast injection as prescribed since contrast-induced nephropathy (CIN) is rare. B. Explain the risks to the patient and seek immediate guidance from the radiologist before proceeding. C. Administer X-Romanoids before and after the procedure to protect kidney function without consulting physician. D. Cancel the contrast injection and perform the CT scan without contrast to avoid nephrotoxicity. Answer. B. Explain the risks to the patient and seek immediate guidance from the radiologist before proceeding. Explanation. Patients with CKD are at increased risk of developing contrast-induced nephropathy (CIN), which can lead to further kidney impairment. The CAMET and Canadian Association of Radiologists (CAR) guidelines recommend risk assessment before administering contrast. Seeking immediate guidance from the radiologist ensures proper evaluation of renal function, e.g. checking EGFR levels and determining whether alternative imaging techniques, e.g. non-contrast MRI or ultrasound, should be considered. Option is incorrect because while CIN is rare, it is still a significant risk for CKD patients and requires careful assessment. Option C is inappropriate because administering Romanoids without a physician's guidance could lead to fluid overload in CKD patients. Option D is incorrect because an absolute decision to cancel contrast should not be made by the technologist alone. Instead, consulting the radiologist ensures an informed decision regarding patient safety. Question 3. Image analysis and interpretation. A technologist is reviewing a digital radiograph of a patient's thoracic spine and notices loss of image contrast with excessive brightness in some areas and excessive darkness in others. Which of the following is the most likely cause of this artifact? A. Excessive KVP, leading to overpenetration and reduced image contrast. B. Use of grid, which has enhanced scatter radiation and reduced image quality. C. Motion blur from patient movement during the exposure. D. Low mass, which resulted in overexposure of the image receptor. Answer A. Excessive KVP, leading to overpenetration and reduced image contrast. Explanation. High KVP settings lead to increased penetration of X-rays, reducing image contrast by allowing more X-rays to pass through tissues with minimal differentiation. This results in a washed-out appearance. Option B is incorrect because grids reduce scatter radiation and improve contrast rather than degrade it. Option C is incorrect because motion blur typically results in a loss of sharpness rather than contrast loss. Option D is incorrect because low mass would generally result in underexposure, not overexposure. Overexposure is caused by high mass or high KVP. The CAMET imaging guidelines emphasize proper selection of exposure parameters to optimize contrast while minimizing radiation dose. Using appropriate KVP and mass ensures diagnostic image quality and prevents unnecessary retakes. Question 4. Topic: Radiation protection and safety. A medical radiation technologist is performing a fluoroscopic procedure on a pediatric patient. The radiologist requests multiple prolonged fluoroscopic exposures to assess gastrointestinal motility. The patient is small and highly radiosensitive, particularly in areas such as the thyroid and gonads. The room is equipped with modern dose reduction technologies, including fluoroscopy and automatic dose rate control. Which of the following strategies would best optimize radiation dose while maintaining diagnostic image quality? A. Use continuous fluoroscopy, a low KVP setting to maintain image contrast. B. Increase the frame rate of fluoroscopy to capture more detailed motion of the gastrointestinal tract. C. Employ pulsed fluoroscopy at the lowest acceptable pulse rate. Use last image hold and ensure proper collimation. D. Remove shielding devices, as they may obscure anatomical structures and require retakes. Answer: C. Employ pulsed fluoroscopy at the lowest acceptable pulse rate. Use last image hold and ensure proper collimation. Explanation: A. Incorrect. Continuous fluoroscopy significantly increases patient dose. Instead, pulsed fluoroscopy should be used to minimize exposure. B. Incorrect. A higher frame rate increases radiation dose without necessarily improving diagnostic accuracy. The lowest pulse rate needed for clinical evaluation should be used. C. Correct. Using pulsed fluoroscopy at the lowest acceptable pulse rate reduces radiation dose while preserving diagnostic quality. The last image hold function reduces the need for continuous exposures, and collimation limits unnecessary exposure to surrounding tissues. These practices align with ALARA as low as reasonably achievable principles and Health Canada's radiation protection guidelines. D. Incorrect. Shielding should be used whenever feasible, especially for radiosensitive organs like the thyroid and gonads. Proper positioning of lead shields helps protect the patient without interfering with diagnostic accuracy. Question 5. Topic: Image analysis and interpretation. A radiology department receives complaints that recent chest X-ray images lack sufficient contrast, making it difficult to distinguish soft tissue structures from lung fields. The images also appear excessively noisy. A review of imaging parameters reveals that the exposure factor settings have been modified in an attempt to reduce patient dose. Which of the following adjustments would best improve contrast and reduce noise while still adhering to dose optimization principles? A. Decrease the KVP and increase the mass while ensuring the exposure index remains within the acceptable range. B. Increase the KVP and decrease the mass to further reduce radiation dose. C. Reduce the exposure time while maintaining the same KVP and mass. D. Increase the focal spot size to allow for greater X-ray penetration. Answer: A. Decrease the KVP and increase the mass while ensuring the exposure index remains within the acceptable range. Explanation: A. Correct. Lowering KVP increases image contrast by reducing scatter radiation. Increasing mass compensates for the lower energy photons, thereby improving image quality while keeping the exposure index within an acceptable range. This aligns with dose optimization guidelines from the Canadian Safety 35. B. Incorrect. While reducing mass reduces dose, increasing KVP results in more Compton scatter, which degrades image contrast. C. Incorrect. Reducing exposure time alone does not improve contrast and can lead to underexposure. D. Incorrect. A larger focal spot decreases image sharpness, worsening the visibility of fine structures. Question 6. Scenario-based. Topic: Computed tomography, CT, and cross-sectional imaging. Dr. Patel, a radiologist, orders a EK of the abdomen with contrast for a patient with suspected abdominal aortic aneurysm. The patient's medical history includes chronic kidney disease with an EGFR of 42 ml on 0.73. The technologist is concerned about potential contrast-induced nephropathy, SIN, and needs to take appropriate precautions. Which of the following actions is the most appropriate in this situation? A. Proceed with the contrast-enhanced CT as ordered, since contrast is necessary for proper visualization of vascular structures. B. Perform non-contrast CT scan instead, as contrast should always be avoided in patients with kidney disease. C. Consult the radiologist to discuss contrast dose reduction strategies and consider pre-hydration protocols. D. Delay the CT scan until the patient's kidney function improves, as administration is contraindicated. Answer: C. Consult the radiologist to discuss contrast dose reduction strategies and consider prehydration protocols. Explanation: A. Incorrect. Although contrast is essential for vascular imaging, the risks of contrast-induced nephropathy must be considered, particularly in patients with impaired kidney function. B. Incorrect. While non-contrast CT may provide some information, it is often insufficient for vascular assessment. Contrast use is not absolutely contraindicated, but should be carefully managed. C. Correct. Consulting the radiologist to explore contrast dose reduction strategies. E.g., low osmolar contrast agents, minimizing volume, and implementing prehydration protocols. Roman align infusion is the best approach. These strategies are supported by the Canadian Association of Radiologists guidelines on contrast media administration. D. Incorrect. Delaying the scan may not be an option. If an aneurysm is suspected, the risk-benefit balance should be evaluated with appropriate precautions taken. Question 7. Topic: Professionalism and ethical considerations. A medical radiation technologist is performing a scan on a patient who refuses the procedure after arriving at the imaging suite. The patient appears anxious and states they do not feel comfortable undergoing the scan. The referring physician had emphasized the importance of the scan, but the patient is adamant about not proceeding. What is the most appropriate course of action? A. Proceed with the scan since the referring physician has already obtained consent. B. Attempt to reassure the patient and continue the scan unless they physically resist. C. Respect the patient's decision, document the refusal, and notify the referring physician. D. Report the patient's refusal to hospital administration and wait for further instructions. Answer: C. Respect the patient's decision, document the refusal, and notify the referring physician. Explanation: A. Incorrect. Consent must be obtained directly from the patient at the time of the procedure. Prior consent does not override the patient's right to refuse at any point. B. Incorrect. Coercing or pressuring the patient violates ethical guidelines. Informed consent must be voluntary. C. Correct. According to the CAMET Code of Ethics, Canadian Healthcare Consent Act, patients have the right to refuse medical procedures. Proper documentation and communication with the referring physician are essential. D. Incorrect. While administrative reporting may be part of hospital protocol, the immediate step should be to respect patient autonomy and inform the physician. Question 8. Topic: Digital imaging and PACS. A radiology department recently upgraded its picture archiving and communication system, PACS. While reviewing images, a technologist notices that some computed radiography (CR) chest X-rays appear overexposed, displaying loss of detail in soft tissue areas. The system uses automatic rescaling, but exposure inconsistencies persist. Which of the following corrective actions would best address this issue while maintaining optimal image quality? A. Increase the exposure factor settings to ensure all images have sufficient brightness. B. Implement a standardized exposure technique chart and educate staff on proper exposure index use. C. Disable the rescaling function in PACS to preserve raw image data. D. Manually adjust brightness and contrast in PACS for each image to correct overexposure. Answer: B. Implement a standardized exposure technique chart and educate staff on proper exposure index use. Explanation: A. Incorrect. Increasing exposure unnecessarily raises patient dose without solving the issue. B. Correct. Standardizing exposure techniques and ensuring that staff properly use the exposure index prevents overexposure while maintaining diagnostic quality. C. Incorrect. Disabling rescaling can lead to improper presentation, making it harder to interpret images. D. Incorrect. Manual adjustments can be inconsistent and do not address the root cause of overexposure. Question 9. Topic: Radiation biology and dose optimization. A pregnant patient is scheduled for an EKG of the pelvis after experiencing severe abdominal pain. The referring physician suspects appendicitis. The patient is concerned about radiation exposure to the fetus and requests information on the risks. What is the best response by the medical radiation technologist? A. Explain that modern CT scanners use low doses of radiation and there is no risk to the fetus. B. Inform the patient that radiation exposure during pregnancy is always unsafe and suggest canceling the scan. C. Discuss potential risks, explore alternative imaging options, and involve the radiologist in decision-making. D. Proceed with the CT scan as it was ordered by the physician without further discussion. Answer: C. Discuss potential risks, explore alternative imaging options, and involve the radiologist in decision-making. Explanation: A. Incorrect. While modern CT scanners minimize dose, fetal exposure must be evaluated case by case. B. Incorrect. Avoiding necessary imaging could delay diagnosis and treatment. C. Correct. Discussing risks, considering ultrasound or MRI alternatives, and consulting the radiologist ensures informed decision-making. D. Incorrect. Patient consent and informed discussions are critical before proceeding with any radiation-based procedure. Question 10. Topic: Quality control in radiology. A routine quality control UC test of a digital radiography doctor system reveals increasing noise levels in images, particularly in low exposure areas. The service engineer identifies a problem with the flat panel detector. Which of the following steps should be taken next? A. Continue using the doctor system and instruct radiologists to manually adjust windowing levels. B. Perform additional tests such as dark, noise, and gain calibration to further diagnose the issue. C. Replace the entire imaging system as increased noise indicates complete system failure. D. Ignore the noise issue as it does not significantly impact high exposure images. Answer: B. Perform additional tests such as dark, noise, and gain calibration to further diagnose the issue. Explanation: A. Incorrect. Adjusting windowing does not fix detector issues. B. Correct. Conducting dark, noise, and gain calibration tests helps pinpoint detector malfunctions. C. Incorrect. System replacement is unnecessary if the issue can be corrected through calibration or part replacement. D. Incorrect. Noise can compromise diagnostic quality, especially in low-dose imaging. Question 11. Topic: Contrast media and inverse reactions. A patient with a history of mild contrast-induced reactions requires an MRI with gadolinium-based contrast. The radiologist is aware of the patient's history and considers whether to proceed with contrast administration. Which precautionary measure is most appropriate? A. Administer the contrast agent without additional precautions since MRI contrast reactions are rare. B. Perform premedication protocol with antihistamines or corticosteroids and closely monitor the patient. C. Avoid contrast administration altogether to eliminate the risk of reaction. D. Use lower dose of contrast to reduce the chance of an adverse reaction. Answer: B. Perform a premedication protocol with antihistamines or corticosteroids and closely monitor the patient. Explanation: A. Incorrect. While rare, gadolinium reactions can still occur. B. Correct. Premedication reduces reaction severity and is recommended for high-risk patients. C. Incorrect. Contrast avoidance may compromise diagnostic accuracy. D. Incorrect. A lower dose does not necessarily prevent hypersensitivity reactions. Question 12. Topic: Computed tomography. CT radiation dose optimization. A 45-year-old patient with a history of kidney stones undergoes a low-dose non-contrast CT scan of the abdomen. The radiologist notices that the image quality is slightly lower than expected, but still diagnostically acceptable. The referring physician requests the repeat scan with higher exposure settings to ensure better image clarity. As A. Nodded. What is the best course of action to balance diagnostic quality and radiation safety? A. Repeat the scan with standard dose parameters as requested by the physician. B. Explain ALARA principles and consult the radiologist before increasing the dose. C. Reject the request and refuse to perform the second scan under any circumstances. D. Increase the mass in kVp significantly to ensure maximum image quality. Answer: B. Explain ALARA principles and consult the radiologist before increasing the dose. Explanation: A. Incorrect. Increasing dose without proper justification contradicts ALARA principles. B. Correct. Consulting the radiologist ensures that any dose increase is justified while keeping patient safety a priority. C. Incorrect. Refusal without discussion may delay patient care. D. Incorrect. Unnecessarily increasing violates radiation protection guidelines. Question 13. Topic: Magnetic resonance imaging MRI safety and metal implants. A 60-year-old patient with a pacemaker is referred for an MRI of the brain due to suspected stroke. The ordering physician is unaware of the MRI compatibility of the pacemaker. Which of the following is the most appropriate next step? A. Proceed with the MRI since modern pacemakers are typically MRI safe. B. Contact the manufacturer or cardiologist to verify MRI compatibility before proceeding. C. Perform the MRI at a lower magnetic field strength to minimize risk. D. Cancel the MRI and inform the physician that pacemaker patients cannot under MRI. Answer: B. Contact the manufacturer or cardiologist to verify MRI compatibility before proceeding. Explanation: A. Incorrect. Not all pacemakers are MARA compatible, and assuming so can be dangerous. B. Correct. Confirming device safety is essential before exposing the patient to a strong magnetic field. C. Incorrect. Reducing field strength does not eliminate all risks associated with pacemakers. D. Incorrect. Many pacemakers are MRI compatible. A verification is necessary before making a final decision. Question 14. Topic: ultrasound Doppler imaging and blood flow analysis. A sonographer performing a Doppler ultrasound of the carotid arteries notices aliasing artifacts when assessing blood flow velocity. Which of the following adjustments is most effective in eliminating aliasing? A. Decrease the pulse repetition frequency PRF. B. Increase the PRF or shift the baseline. C. Lower the transducer frequency. D. Just the dynamic range of the image. Answer: B. Increase the PRF or shift the baseline. Explanation: A. Incorrect. Lowering PRF increases aliasing rather than reducing it. B. Correct. Increasing PRF or shifting the baseline helps avoid aliasing by allowing higher velocity detection. C. Incorrect. Lowering frequency affects resolution but does not directly resolve aliasing. D. Incorrect. Dynamic range adjustments control contrast but do not fix aliasing. Question 15. Topic: fluoroscopy radiation protection measures during a non-fluoroscopic procedure. A physician requests continuous imaging for a complex interventional case. The radiation technologist is concerned about excessive patient dose. What is the best approach to minimize radiation exposure while ensuring procedural success? A. Use pulsed fluoroscopy and limit exposure time. B. Increase KVP and to improve image quality at all times. C. Remove lead shielding to avoid interference with the procedure. D. Decrease the image intensifier distance to maximize detail. Answer: A. Use pulsed fluoroscopy and limit exposure time. Explanation: A. Correct. Pulsed fluoroscopy reduces overall radiation exposure without compromising diagnostic accuracy. B. Incorrect. Higher KVP and increased radiation dose unnecessary. C. Incorrect. Removing shielding exposes unnecessary areas to radiation. D. Incorrect. Bringing the image intensifier closer improves detail but does not directly lower patient dose. Question 16. Topic: ethical decision-making in radiology. A patient undergoing a mammogram is extremely anxious about the procedure and asks whether she can skip the exam. She mentions that she has no symptoms but was advised to undergo the screening due to her age. As the radiologic technologist, what is the most appropriate response? A. Explain the importance of early detection and allow the patient to make an informed decision. B. Insist that the patient complete the mammogram since it was ordered by the doctor. C. Proceed with the exam without addressing her concerns to avoid unnecessary delays. D. Cancel the exam immediately if the patient expresses discomfort. Answer: A. Explain the importance of early detection and allow the patient to make an informed decision. Explanation: A. Correct. Patients should be educated on the benefits of screening, but the final decision is theirs. B. Incorrect. Forcing an exam violates patient autonomy. C. Incorrect. Ignoring patient concerns reduces trust and compliance. D. Incorrect. Cancelling the exam without discussion may lead to missed early detection opportunities. Question 17. Topic: nuclear medicine. PET imaging. PET scan is ordered for patient to evaluate for metastatic cancer. The radiopharmaceutical used is fluorodeoxyglucose F18-FDG. Which of the following patient preparation steps is most critical for optimal imaging results? A. Ensure the patient consumes high-carb meal 30 minutes before the scan. B. Instruct the patient to refrain from strenuous physical activity for 24 hours. C. Have the patient drink high caffeine beverage to improve image contrast. D. Allow the patient to walk around before the scan to encourage radiotracer uptake. Answer: B. Instruct the patient to refrain from strenuous physical activity for 24 hours. Explanation: A. Incorrect. High-carb meals increase glucose levels and reduce FDG uptake in tumors. B. Correct. Avoiding exercise prevents FDG uptake in muscles, which could obscure findings. C. Incorrect. Caffeine does not improve PET image quality. D. Incorrect. Physical activity leads to unwanted FDG uptake in muscles. Question 18. Topic: X-ray image artifacts and troubleshooting. A radiology department upgrades to digital radiography. Doctor and technologists notice artifacts appearing in images. The artifacts are consistent, linear, and occur in the same location across multiple images. Which of the following is the most likely cause of this issue? A. Poor collimation technique. B. A defective detector element. dead pixel row in the doctor system. C. Excessive motion by the patient during exposure. D. Low exposure factors leading to quantum mottle. Answer B. A defective detector element. Dead pixel row in the doctor system. Explanation A. Incorrect. Collimation errors usually result in cutoff artifacts, not linear streaks. B. Correct. Dead pixels in the detector array cause repeated linear artifacts in the same location. C. Incorrect. Motion artifacts appear as blurring, not fixed lines. D. Incorrect. Quantum mottle appears as grainy noise, not structured lines. Question 19. Topic: Contrast media reactions in CT imaging. A 57-year-old patient with a history of mild asthma and no prior contrast reactions undergoes a contrast-enhanced CT scan. Shortly after intravenous Romanette contrast administration, the patient experiences mild urticaria hives but remains hemodynamically stable. What is the most appropriate next step? A. Stop the contrast injection and administer diphenhydramine Benadryl. B. Immediately administer epinephrine and call a code blue. C. Continue the contrast injection as planned since the reaction is mild. D. Stop the scan and advise the patient never to receive contrast again. Answer A. Stop the contrast injection and administer diphenhydramine Benadryl. Explanation A. Correct. Mild allergic reactions hives are usually managed with antihistamines like diphenhydramine. B. Incorrect. Epinephrine is used for severe reactions, anaphylaxis, not mild urticaria. C. Incorrect. Continuing contrast administration without intervention may worsen the reaction. D. Incorrect. Mild reactions do not contraindicate future contrast use, especially with premedication. Question 20. Topic: MRI safety. Ferromagnetic object incident. During an MRI brain scan, nurse enters the MRI room with pair of scissors in her pocket. The scissors are quickly pulled toward the MRI magnet, nearly striking the patient. What is the best immediate action? A. Stop the scan, remove the object, and check the patient for injuries. B. Continue the scan, but ensure the nurse removes all other metal objects. C. Turn off the MRI magnet immediately using the emergency quench button. D. Allow the scan to continue and review safety protocols after the procedure. Answer A. Stop the scan, remove the object, and check the patient for injuries. Explanation A. Correct. Patient safety is the priority. The scan should be stopped and the patient checked for harm. B. Incorrect. The scan should not continue until safety risks are fully addressed. C. Incorrect. Quenching, turning off the magnet, is only for life-threatening emergencies. D. Incorrect. Safety issues must be addressed immediately, not after the scan. Question 21. Topic: Radiation protection. In fluoroscopy, a physician performing a fluoroscopic procedure asks the technologist to increase the frame rate for better visualization. The technologist is concerned about higher radiation exposure to the patient. Which of the following adjustments would be the best compromise between image quality and radiation dose? A. Use pulsed fluoroscopy instead of continuous mode. B. Increase the fluoroscopy time but lower the kVp. C. Reduce patient shielding to prevent image obstruction. D. Increase the frame rate as requested, regardless of dose concerns. Answer A. Use pulse fluoroscopy instead of continuous mode. Explanation A. Correct. Pulse fluoroscopy reduces radiation exposure while maintaining adequate image quality. B. Incorrect. Increasing fluoroscopy time increases dose and lowering kVp may degrade image quality. C. Incorrect. Shielding should never be removed to reduce dose. D. Incorrect. Dose concerns must always be balanced with image needs. Question 22. Topic: Ultrasound artifacts and optimization. The sonographer is scanning a patient's gallbladder and notices shadowing artifact posterior to suspected gallstone. The physician requests clear visualization of the structure. Which of the following techniques can best enhance image clarity? A. Increase the transducer frequency. B. Use harmonic imaging to improve contrast resolution. C. Lower the overall gain and decrease depth. D. Adjust the Doppler angle to reduce shadowing. Answer B. Use harmonic imaging to improve contrast resolution. Explanation A. Incorrect. Increasing frequency enhances resolution but does not reduce shadowing. B. Correct. Harmonic imaging improves contrast resolution, making structures more distinct. C. Incorrect. Lowering gain and depth may degrade overall image quality. D. Incorrect. Doppler angle adjustments do not affect shadowing artifacts. Question 23. Topic: Ethical dilemma. Patient confidentiality in radiology. Radiologic technologists perform CT scan on well-known celebrity. Colleague later asks to see the patient's images out of curiosity. What is the most ethical response? A. Politely decline and remind the colleague of HIPAA regulations. B. Allow the colleague to view the images if they promise confidentiality. C. Share only non-identifiable portions of the scan for educational purposes. D. Report the request to hospital administration immediately. Answer A. Politely decline and remind the colleague of HIPAA regulations. Explanation. A. Correct. HIPAA prohibits unauthorized access to patient information. B. Incorrect. Confidentiality rules apply regardless of personal assurances. C. Incorrect. Even partial data sharing requires patient consent. D. Incorrect. Reporting may be unnecessary unless further violations occur. Question 24. Topic: Nuclear medicine. Patient preparation for bone scan. Patient scheduled for bone scan with TC 99 meters MDP asks how long they should wait after the injection before imaging begins. What is the most appropriate response? A. Imaging should start immediately after injection. B. Imaging should begin 2-3 hours after injection to allow tracer uptake. C. Imaging should be delayed for 24 hours for optimal results. D. The patient can return home and return after 48 hours for imaging. Answer B. Imaging should begin 2-3 hours after injection to allow tracer uptake. Explanation. A. Incorrect. Immediate imaging does not allow enough time for bone uptake. B. Correct. The standard waiting period allows optimal uptake in the skeletal system. C. Incorrect. A 24-hour delay is unnecessary for routine bone scans. D. Incorrect. 48-hour imaging is not standard protocol. Question 25. Topic: X-ray equipment malfunction and troubleshooting. A technologist performing a chest X-ray notices a sudden decrease in image brightness despite using the same exposure settings. What is the most likely cause? A. The X-ray tube filament has burned out. B. The automatic exposure control (EEC) sensor is malfunctioning. C. The KVP setting is too high. D. The patient's body habitus is affecting exposure. Answer B. The automatic exposure control (EEC) sensor is malfunctioning. Explanation. A. Incorrect. A burned out filament would result in no exposure, not low brightness. B. Correct. A malfunctioning EEC sensor can underexpose images, reducing brightness. C. Incorrect. High KVP would cause overexposure, not underexposure. D. Incorrect. While patient size affects exposure, it does not suddenly reduce brightness. Question 26. Topic: CT scan. Managing patient motion artifacts. 65-year-old patient with severe Parkinson's disease is scheduled for CT angiogram (ETA) of the brain to assess for possible stroke. The patient has difficulty remaining still during the scan, resulting in significant motion artifacts that degrade image quality. Which of the following is the best solution to improve image clarity? A. Instruct the patient to hold their breath for as long as possible. B. Use faster scan time and motion correction software. C. Increase the radiation dose to compensate for motion blur. D. Perform the scan without contrast to reduce imaging time. Answer B. Use of faster scan time and motion correction software. Explanation. A. Incorrect. Parkinson's patients often cannot voluntarily control movement, making breath holding ineffective. B. Correct. Faster scan times and motion correction software help reduce motion artifacts. C. Incorrect. Increasing radiation dose does not solve motion blur issues. D. Incorrect. CTA requires contrast to evaluate blood vessels properly. Question 27. Topic: MRI contrast safety. Gadolinium in renal failure patients. 72-year-old patient with chronic kidney disease EOR25 ailment on 0.73 is scheduled for an MRI with gadolinium-based contrast. The radiologist asks for guidance on whether contrast administration is safe. What is the most appropriate course of action? A. Proceed with gadolinium contrast without any concerns. B. Cancel the MRI and recommend CT scan instead. C. Assess the necessity of contrast and consider non-contrast MRI if possible. D. Use gadolinium contrast at higher dose to ensure adequate imaging. Answer C. Assess the necessity of contrast and consider a non-contrast MRI if possible. Explanation. A. Incorrect. Gadolinium carries a risk of nephrogenic systemic fibrosis (NSF) in CAD patients. B. Incorrect. MRI may still be appropriate, and CT contrast also poses risks in kidney disease. C. Correct. Non-contrast MRI should be considered first. If contrast is essential, a low-risk gadolinium agent should be cautiously. D. Incorrect. A higher dose increases the risk of NSF. Question 28. Topic: Radiation safety. Pregnant patient undergoing X-ray. 28-year-old pregnant woman, 14 weeks gestation, is sent for an abdominal X-ray after motor vehicle accident. She expresses concerns about radiation exposure to her baby. What is the best response? A. Reassure her that the radiation dose is too low to cause harm. B. Cancel the X-ray and refuse imaging during pregnancy. C. Proceed with the X-ray but use lead shielding over the abdomen. D. Replace the X-ray with an MRI, which does not use ionizing radiation. Answer C. Proceed with the X-ray but use lead shielding over the abdomen. Explanation. A. Incorrect. While the dose is generally low, patient concerns should be addressed with appropriate precautions. B. Incorrect. If the X-ray is medically necessary, it should not be refused outright. C. Correct. Lead shielding minimizes fecal radiation exposure while allowing diagnostic imaging. D. Incorrect. MRI may not be suitable for all trauma and availability may be limited. Question 29. Topic: ultrasound. Doppler imaging in venous thrombosis. 52-year-old patient with leg swelling and pain undergoes Doppler ultrasound to assess for deep vein thrombus DVT. The technologist cannot detect venous flow in the affected leg and the vein does not compress with probe pressure. What is the most likely interpretation? A. The patient has an occlusive of DVT, which is preventing blood flow. B. The patient has peripheral artery disease PAD, causing reduced venous flow. C. The ultrasound transducer frequency is too high to detect venous flow. D. The lack of compression suggests normal vein with low blood volume. Answer A. The patient has an occlusive DVT, which is preventing blood flow. Explanation. A. Correct. An occlusive DVT prevents blood flow and prevents the vein from compressing. B. Incorrect. PAD affects arteries, not veins. C. Incorrect. While frequency matters, it would not completely eliminate flow detection. D. Incorrect. Lack of compression is a strong indicator of thrombosis. Question 30. Topic: nuclear medicine. PET scan false positives. 47-year-old cancer patient undergoes PET-ET scan for cancer staging. The scan shows increased FDG uptake in the muscles, but no obvious tumor recurrence. The patient reports intense exercise the day before the scan. What is the best explanation for the findings? A. The patient's muscle activity increased FDG uptake, leading to false positive. B. The cancer has spread to the muscles, requiring urgent biopsy. C. The patient likely has severe infection, which causes similar PET scan findings. D. The FDG dose was too high, leading to excessive uptake in muscles. Answer A. The patient's muscle activity increased FDG uptake, leading to false positive. Explanation. A. Correct. Intense exercise increases glucose metabolism in muscles, leading to false positive uptake. B. Incorrect. Cancer rarely spreads symmetrically to muscles. C. Incorrect. Infection can increase uptake, but no signs of illness were mentioned. D. Incorrect. FDG dose does not selectively affect muscles.